Hi, my name is Douglas Austin, and for this presentation, I decided to look at an article that was titled Hepatitis C Infections and Swiss HIV Cohort Study. So for starters, hepatitis C is a major cause of morbidity and mortality in people infected with HIV. Outbreaks of HCV among men who have sex with men, otherwise known as MSM, have increased in the past few years. Because of this, a better understanding of HCV incidence rates and transmission patterns in HIV communities is urgent. And once again, this is because of the burden of HCV-related diseases in HIV-infected patients. Some of these diseases could be cirrhosis, liver cancer, or liver failure. So the Swiss HIV Cohort Study, otherwise known as SHCS, was used for this study. The HCV incidence was assessed in 1998. That's when they first started screening for HCV, and lasted until 2011. So the main objective for the study was to find the long-term HCV incident rates among different transmission groups. While there were many different groups, overall the three main HIV transmission groups were looked at: MSM, heterosexuals, otherwise known as HET, and injection drug users, otherwise known as IDU. The populations of focus for the study were the following: MSM, IDU, and HET. Also, it is important to note, to avoid erroneous classifications, MSM and HET patients who reported using injection drugs were excluded from the study. So the SHCS is what's known as a prospective cohort study. And the reason it's called this is because patients were chosen based on a set of criteria, and they were then followed over a period of time. For the sample size, 6,534 patients were chosen overall. 3,333 of them were from the MSM community, 123 were from the injection drug use, and 3,078 were heterosexuals. Some recruiting strategies to bring patients in were that local ethic committees had the study approved. Also, the patients were asked to provide written consent before their information can be used. For the inclusion criteria, every patient must be screened for HCV infection, and also the serology is performed every second year of follow-up and is independent of HIV transmission mode. For the exclusion criteria, the MSM and HET patients were excluded if they reported using injection drugs, like stated before. Also, patients with positive HCV serology at entry and then seroconverted before 1998 were excluded. After looking through this article, I found that nothing was mentioned about randomization, therefore it wasn't applicable to this study. So, some difference in variables. First off, there were no controls group. The median age for the MSM community was 38. For HET, it was 36. And IDU was 33. So some slight differences right there. Also, the MSM community had a higher level of education when compared to the other two groups. Also, almost half of the MSM and IDU, but only 29% of HET had their follow-up in Zurich, which is Switzerland's largest urban center. And finally, HET was more likely to be non-Caucasian, about 40%, than either MSM or IDU, which is 7.7% and 8.9%, respectively. So, for the statistical analysis performed, the authors used sample size calculations. Yearly HCV infection incident rates were calculated by using the regression models with non-parametric smoothing priors. This specific model was used because of overdispersion. Overdispersion can be caused by positive correlation among observations, and the model used captures this and provides a better fit overall. Also, it's just important to note that incident rates, IRs, are reported as a number of cases per 100 person years. So, for the results, for univariate, the median age was 34.9 years in seroconverters and 37.7 years in non-seroconverters, and the proportion of Caucasians was 93% and 92%, respectively. In both groups, greater than 90% of patients started antiretroviral therapy, otherwise known as ARTs, before or during follow-up. However, previous HBV exposure, a past history of syphilis, and inconsistent condom use were more common in HCV seroconverters. For multivariate results, in the adjusted Cox regression analysis, only inconsistent condom use, an adjusted hazard ratio of 2.09 with a 95% confidence interval of 1.33 through 3.29, and previous diagnosis of syphilis with an adjusted hazard rate of 2.11, once again a 95% confidence interval of 1.39 to 3.2, were significantly associated with HCV seroconversion. For author conclusions, the authors concluded that in the SHCS, HCV infection incidence decreased in IDU, remained stable in HET, but increased 18-fold in MSM in the last 13 years since the study started. I agree with this conclusion. Reading throughout the article, it was noted that high-risk sexual behaviors in the MSM community have contributed to this 18-fold increase, specifically inconsistent condom use and having a past episode of syphilis was significantly associated with increased HCV seroconversion. One bias that I found was that could have existed was recall bias. And what this was is participants could have denied ever using injection drugs or just had a selective memory, which could understate the IDU group that was being observed, thus skewing the results. A limitation was found that there was suboptimal sensitivity and specificity of HCV antibody assays, which means that the test could have possibly provided some false negatives or false positives, which could have further thrown the results off. Also, some patients could have lost their antibodies after seroconversion due to spontaneous HCV clearance. This could also skew the results. The findings were applicable to the study because the authors found a serious disparity in the MSM population. So once again, 13 years after the study started, there was that 18-fold increase. And what this really underscores is that there's a need for education and surveillance for HCV in this population. So an ideal study designed for their hypothesis would be conduct another cohort study specifically for the MSM population and measure different risk factors for HCV infection. And by expounding on this and this alone, and the transmission patterns for HCV and the MSM community could be understood even further. Thank you.